Hi, everybody. It's Dr. John Callahan here again. We've been talking about the five to keep you alive. What are some really important biomarkers that we can tell how our health is going to turn out as time goes on? So, the first week, we talked about the muscle to fat ratio. Last week, we talked about blood pressure and resting pulse. And this week, we're going to talk about something called fasting insulin levels. Now, a lot of people have had fasting glucose done, but not as many have fasting insulin done. If you take fasting insulin, it's a much better predictor of who is more prone to developing diabetes, heart disease, and obesity related cancers. So, as some of you probably already know, insulin's what drives sugar into our bodies to help us produce energy. It's a very important part of our lives. Um, However, if you have more sugar in your body than it needs, insulin will help you store the sugar in your liver, and then it releases when your blood sugar is low or if you need more sugar, like between meals or during physical activity. So insulin basically balances out our blood sugar and it keeps it in a normal range if everything's working like it should. As blood sugar level rise, pancreas secretes more insulin, those beta cells of the pancreas. However, if the body doesn't produce enough insulin or your cells are resistant, if you've developed something called insulin resistance, you can develop something called hyperglycemia, which means you have sustained high levels of blood sugar, and that can be very damaging to your body. Uh, at any one time, there's approximately 4 grams of sugar circulating in your blood, and the rest has to be stored in your liver as glycogen. But once that storage tank is full, the body will start to convert excess sugar to, excuse me, excess sugar to triglycerides, and the excess triglycerides eventually get converted to fat. Sometimes, a lot of times, it lands in the visceral or the belly area and it gets stored there. So, in a sense, insulin's almost like fat fertilizer, so to speak. It makes cells fat. In fact, all cells will get bigger with the insulin. In And then we talked the first week about how damaging visceral fat is. That's the worst kind of fat to have because of all the toxins that are released and chemicals that are released. And of course, one way you can measure that is through waist circumference. For men, you should have a waist circumference under 40 inches, and women should have under 35 inches. We have what's called bioimpedance analysis machine here at the clinic that will help you measure that. So the body doesn't like excess glucose because glucose crosses the blood-brain barrier and it can do damage to your brain, and your body has mechanisms to keep that under control. Um, One of the mechanisms that the body uses is that it gets attached to other fats and proteins, and this is a process called glycation. Glycation end products are not good for your health. Glucose actually stiffens proteins and fats, and it ages your cells more rapidly. And that's, sometimes you get a person who's 50 that looks older, and some people look younger than their age. A lot of times it's because people are aging more rapidly because the sugar and the toxins of their bodies are in fact aging their bodies more rapidly. One of the advanced glycation end products is something called hemoglobin A1C. If you know someone who's a diabetic, you get your A1C, what it's called, tested pretty frequently. But that's a marker for prediabetes and diabetes. There's also others, but A1C is another important part of measuring the effect of your blood sugar. So, in a sense, it isn't necessarily the high blood sugar that's the problem, it's the high insulin levels that are the problem. Insulin's an anabolic hormone, which means it makes things grow, including cells that are sensitive to insulin, such as muscle, fat, liver, and unfortunately cancer cells as well. There's just a listing here that I've got, some of the things that too much insulin can help the body develop over time. It can be one of the factors that gives you a fatty liver because all the glucose is being stored as fat in the liver. It can cause kidney disease, which is, of course, a side effect of diabetes. Can also cause cardiovascular disease because fat is stored in your blood vessels and it becomes hardened or stiffened by the process of glycation, which we just discussed previously. It also can increase your risk of obesity-related cancers such as breast and colon cancer due to the fact that insulin is an anabolic hormone. It also causes lots of inflammation because visceral fat produces lots of inflammatory chemicals, and we had discussed that as well. So, the question comes up, should you have your fasting insulin checked on a regular basis? And I would say absolutely. A good number to shoot for would be 3 to 5. And most people, that we test sometimes will have a level that's double or triple, or sometimes even worse than that. So, how does a person lower their fasting insulin? Well, one simple thing you can do is stop eating so many refined carbohydrates and also decrease portion size. I mean, both those things cause major releases of insulin from the pancreas. Another thing you can do is begin to exercise because exercise stimulates release of fat from cells and burns excess fat and sugar. So we want to stop being a sugar and fat store and start becoming a sugar and fat burner. We can't do both at the same time. You're either storing sugar as fat or burning fat as sugar. One of the things in 8 Weeks to Wellness, one of our goals is to lower those insulin levels by reducing the bad carbohydrates. A lot of times we're eating a lot of vegetables, maybe a little bit of fruit, and we start incorporating exercise in the form of cardiovascular and strength training, 3 to 5 times a week. Those things are programmed as a major part of the 8 Weeks to Wellness program. If you're interested in checking that out, look at www.8ww.com. So now that you know the importance of one of those biomarkers, remember it's fasting insulin. So next week we'll have number 4 of 5, and until that time, we'll look forward to talking to you then. Thanks a lot.